Oklahoma HB 1219 is a bill introduced in February 2025 that prohibits any state agency from using any public funds to develop, organize, administer, engage in, promote, or endorse any activity that recognizes LGBTQ plus Pride Month or any similar theme. That single sentence is the entire engine of the bill. It does not regulate conduct. It does not regulate curriculum. It does not regulate healthcare. It regulates visibility. It regulates acknowledgement. It regulates the right of a community to exist in public memory. HB 1219 is not a budget bill. It is not a morality bill. It is an erasure bill. And erasure is not symbolic. Erasure is a policy tool. HB 1219 targets state agencies which include public schools, universities, health departments, mental health agencies, child welfare agencies, corrections, public libraries, state-funded shelters, state-funded hospitals, state workforce offices, state-run crisis centers, state-run youth programs, and state-run elder programs. Every agency that touches a human life in Oklahoma is covered. The bill forbids these agencies from using any amount of public money, even a single dollar, to develop, organize, administer, engage in, promote, or endorse any activity that recognizes Pride Month or LGBTQ plus themes. This includes social media posts, educational flyers, health awareness campaigns, suicide prevention messaging, library displays, community events, staff trainings, public statements, resource lists, partnerships with LGBTQ plus organizations, pride flags, pride stickers, Pride Month acknowledgments, even a single sentence in a newsletter. This bill's language is intentionally broad. It is designed to create maximum chilling effect with minimum text. HB 1219 is not about money. It is about silence. It is about removing LGBTQ plus people from public conversation, public education, public health, public safety, and public memory. The bill's purpose is to make LGBTQ plus people administratively invisible. When a government cannot criminalize a group directly, it often begins by erasing them from public institutions. HB 1219 is a textbook example of that strategy. Bills like HB 1219 follow a long pattern in Oklahoma legislative history. Jim Crow laws that banned promotion of racial equality, anti-communist laws that banned promotion of certain ideas, anti-gay, no promo homo laws in the 1980s and 1990s, anti-trans bathroom bills in the 2010s, anti-DEI laws in the 2020s. The mechanism is always the same. Identify a marginalized group. Restrict public acknowledgement of that group. Restrict public support for that group. Restrict public resources for that group. Restrict public presence of that group. Restrict public existence of that group. HB 1219 sits at step 2 and 3. The visibility restriction stage. This is the stage where governments test how much erasure the public will tolerate. HB 1219 does not create criminal penalties. It does not create civil penalties. It does not create fines. Instead, it uses administrative enforcement. Agencies risk losing funding. Directors risk losing positions. Staff risks disciplinary action. Programs risk being shut down. Schools risk state intervention. Libraries risk losing grants. The bill weaponizes fear of punishment, not punishment itself. This is how censorship laws often work. They rely on self-censorship. LGBTQ plus Oklahomans already face higher rates of suicide attempts, higher rates of homelessness, higher rates of family rejection, higher rates of discrimination, and higher rates of violence. Pride Month is not a party. It is a public health intervention. It is time when crisis lines increase outreach, health departments share resources, HIV testing campaigns expand, mental health agencies promote support, schools highlight anti-bullying programs, shelters advertise inclusive services. HB 1219 shuts all of that down. It removes the annual window when LGBTQ plus people are most likely to see life-saving information, affirming messages, community resources, and public support. The bill does not just erase visibility, it erases lifelines. In schools, HB 1219 means no Pride Month recognition, no LGBTQ plus history displays, no inclusive library exhibits, no staff training on LGBTQ plus youth, no suicide prevention messaging that mentions LGBTQ plus students, no posters that say, "You are safe here," no partnerships with LGBTQ plus youth organizations. For LGBTQ plus students, this means increased isolation, increased bullying, increased mental health risks, increased dropout rates, increased homelessness, increased suicide risks. For teachers, it means fear of discipline, fear of complaints, fear of losing their jobs, fear of acknowledging LGBTQ plus students at all. HB 1219 turns schools into silence zones. Libraries are often the only safe spaces for LGBTQ plus youth in rural areas. HB 1219 means no pride displays, no LGBTQ book lists, no inclusive programming, no partnership with LGBTQ plus authors, no community events, no safe space signage. It forces libraries to choose between serving their community, obeying the state. This is not neutrality. This is state-mandated erasure. HB 1219 forces state employees into impossible positions. A social worker cannot share LGBTQ plus resources. A public health nurse cannot promote LGBTQ plus health campaigns. A correction officer cannot acknowledge LGBTQ plus support groups. A teacher cannot display a pride sticker. A librarian cannot host an LGBTQ plus book club. The bill turns public employees into instruments of silence. For LGBTQ plus adults, HB 1219 means fewer resources, fewer public supports, fewer visible signs of safety, fewer affirming institutions, fewer community events, fewer public acknowledgments. It tells LGBTQ plus adults, you are not part of the public this state serves. For LGBTQ plus youth, HB 1219 is devastating. It removes representation, affirmation, safety signals, supportive messaging, community visibility, and public acknowledgement. It tells LGBTQ plus youth, you are alone. And for many, that message is deadly. Families with LGBTQ plus kids lose access to resources, access to support groups, access to educational material, access to affirming programs, access to public health information. HB 1219 isolates families at the exact moment when they need connection. In rural Oklahoma, there are fewer LGBTQ plus organizations, fewer affirming providers, fewer community spaces, and fewer support networks. Pride Month is often the only time LGBTQ plus people in rural areas see themselves reflected in public life. HB 1219 removes that. It deepens rural isolation. Democracy requires representation, participation, visibility, and acknowledgement. HB 1219 undermines all four. It tells LGBTQ plus Oklahomans, you are not part of the public this government recognizes, and this is not neutrality. This is state-sponsored exclusion. HB 1219 is not an isolated bill. It is part of a larger legislative pattern in Oklahoma, restricting gender-affirming care, restricting ID changes, restricting school recognition, restricting public accommodations, restricting LGBTQ plus curriculum, restricting LGBTQ plus performance, restricting LGBTQ plus families. HB 1219 is the visibility piece of a larger puzzle. When you remove visibility, you weaken resistance. When you weaken resistance, you can pass harsher laws. HB 1219 is a softening blow before the harder hits. Erasure is not abstract. Erasure feels like walking into a school and seeing nothing that reflects you. Walking into a library and finding your identity removed. Walking into a clinic and seeing no LGBTQ plus health materials. Walking into a government office and feeling unwelcome. Walking into a crisis and finding no public resources. Walking into your own state and feeling invisible. HB 12 Pride Month. It is about who is allowed to exist in public. HB 1219 is a bill that says, we will not see you. We will not acknowledge you. We will not support you. We will not allow our institutions to recognize your existence. This is a bill that uses silence as a weapon. It is a bill that uses erasure as policy. It is a bill that uses invisibility as punishment. And the people who feel its impact most are LGBTQ plus youth, LGBTQ plus adults, families, teachers, librarians, healthcare workers, rural communities, and anyone who believes public institutions should serve everyone. HB 1219 is not about money. It is about memory. It is about who gets to be remembered and who the state is trying to forget.